can your own body rob you of something essential that you need for your life? I feel like this every time I put on weight inexplicably. I didn't eat much the other day, but suddenly I found that my jeans weren't fitting, and I went to my doctor. Yes, I panic and I go to the doctor for everything, but that's the benefit of being a health journalist, that I can reach out to doctors all the time. So I went to her and I said, I don't understand. How am I putting on weight? And she said, oh, you're aging, your metabolism has slowed down. So no matter what you do, you will put on some extra weight now. And I said, all right. Then a few months later, I started having trouble sleeping. And I really wanted to sleep. My mind was completely ready to fall asleep, but my body wasn't resting. And then I started realizing that there is an entire gamut of conditions that can just creep up on you out of the blue. Like you have absolutely no idea that you are heading that way. And the next thing you know, you're in a doctor's chair and they say, you might turn blind soon, which is the case with glaucoma, which, is popularly known as the sneak thief of vision, because the symptoms just happen so slowly and you just so often miss them. This is Sonali Acharji, and you are listening to Health Wealth, a podcast that wants to leave you feeling better informed about your well being, but also with the motivation and the tools needed to make the right choices for your health. I might say that, the body gets the better of me at times, but I have realized that there are ways in which you can push yourself beyond your bodily limitations. So over the weekend, my colleague Bandeep Singh had done an exhibition on the Naga sadhus and their way of life, their philosophies, and how do they conquer their body with just the power of the mind. And I found it so interesting, in certain things, having that strength of your inner self, that conviction that, okay, fine, um, my hand is saying, put me down, but I want to keep my hand up for 17 years. I can still somehow do that. Or I am really stressed out. Everyone around me is expecting me to put on the perfect podcast, but I can still choose to keep my inner peace. I just have to have that strength inside me. And I feel for a lot of things, I can do that. I started applying that only yesterday. Actually, I started applying that to my sleep and to my weight, saying that, it's okay if my body decides that it doesn't want to sleep or wants to put on some extra fat for a day of drought or famine, which is never going to happen, or hopefully will never happen. But it's okay if my body chooses to do that. I can still be strong and continue doing the right things for myself. I don't have to say that, oh, my body has conquered me. And I feel for a lot of things, I could definitely do this, except for the loss of my vision. I cannot imagine getting to a point where I can't see. I mean, I know that things have improved a lot, and accessibility is something we're at least talking a lot more about in this country. But still, I mean, vision is my reason for living, to be able to see colors, to be able to observe people, to be able to connect to emotions. Without my sight, I just can't imagine life. And so every time I go for an eye exam and I get that last row of alphabets correct, I'm like, I need a Kit Kat today. Like, I am super excited and happy, and I feel I deserve a treat. But even then, I could one day have issues with my vision. And I thought, since screen times are unavoidable, since, pollution is there, and they say pollution harms your eyes as well, and there's just this whole ecosystem we've created, which may or may not be very good for our eyes. I thought we should do an episode which really examines how do we take care of our eyes and how do we sort of detect something like glaucoma before it gets the better of us. So we have with us today Dr. Tanuj Dada. He is the professor of ophthalmology and the head of glaucoma services at the RP Center for Ophthalmology at AIIMS, New Delhi. Hello, sir. How are you?
Very fine, thank you.
You know, nothing makes me happier than going to the ophthalmologist's office just because I feel the sense of relief that, nothing is wrong with my eyes. And I think I go a little too often, than what's needed for someone my age. So could you perhaps just start by telling us a little bit about how often should, say, a middle-aged person with normal vision go in for eye exams?
So I think if you are above the age of 35 years, so you should start getting your eye exam done. And the best time is when you start having difficulty in reading. That is a time when you go to a optical shop and get reading glasses. So that is a time when everybody must get a thorough eye checkup done for glaucoma. So as per the current recommendations, if you are above the age of 35 years, then every 2 to 3 years you must get a thorough eye examination done by a qualified ophthalmologist. And if you are above the age of 60 years, then an annual exam is recommended to pick up any eye diseases such as glaucoma.
Right. And you mentioned, of course, the disease that we want to talk about today. Could you just explain what it is? And I believe there are different types of glaucoma as well.
Yes.
So if you could walk us through that.
So glaucoma, also known as kala motia, is a disease of the optic nerve of the eye. So I'll just explain in a layman's term. So like the eye that we see is like a camera. So it captures the image of the surroundings, and then that image is transferred to the brain. That cable transferring the image from the eye to the brain is known as the optic nerve. So glaucoma is basically a disease of the optic nerve. The optic nerve gets damaged, and if not treated in time, that can lead to blindness. So glaucoma is basically can occur at any age of life. You have newborn glaucoma, babies born day one you detect glaucoma. You can have teenagers with glaucoma, and of course adults and elderly. As the age increases, the risk of glaucoma increases. So glaucoma can occur at any age group. The common forms of glaucoma we normally see are classified into two broad categories. One is known as open angle glaucoma, and this other one is known as angle closure glaucoma. So these are the two main types of glaucoma. In addition, you may have glaucoma due to drugs. Some drugs can cause glaucoma, or if you have a eye injury that can cause glaucoma, or you have any other inflammation in the eye. So these are known as secondary glaucoma. So these are the various types of glaucoma that we see in adults. And the form I told you in children, that is known as congenital glaucoma, and in teenagers that is known as juvenile glaucoma. So these are some of the broad categories of glaucoma that we see in our patients.
Yeah. You know, you mentioned eye injury, and recently I had a friend, and she was getting those facials done where they put a lot of scrubs, and a particle of the scrub went inside the eye, and it obviously injured the eye. And it just made me feel that so many things we do in our day-to-day life can cause injury to the eye, and we take it so lightly,
Yes.
especially screens, which is just so unavoidable. Even though you hear it a million times, you still, I'm on a screen with you right now, talking about eyes. So are you seeing instances of diseases like glaucoma increasing in India, and what is commonly causing it?
See, let us first come to this eye injury. This is a very important issue because, like, you have school children who are playing, and then they get hit by a tennis ball or a cricket ball, or when you're playing badminton. So that thing hits the eye, and that time they may have very transient symptoms, like they may have just redness, and it may not cause any decrease in vision. But what happens that injury due to that ball or that shuttlecock causes some changes inside the eye, which leads to glaucoma after 10 to 20 years. So many times we see these patients coming to us with one eye is blind from glaucoma, in the coming by the age of 30, 40 years. And when we ask them, they said, yes, we had an injury when we were in school. So this is specific type of glaucoma known as angle recession glaucoma. The glaucoma develops 10 to 20 years after the injury. So I think two important take home messages: if you are engaging in any sort of sports, it is better to wear some protective eyeglasses or a helmet if you're playing actual cricket or a hockey to prevent eye injury. And secondly, if you have had an eye injury and even though you have seen a doctor that time, there is no problem, your vision is okay, you must go ahead and get an annual checkup done throughout your life, because this glaucoma following injury develops many years after injury and there may not be any symptoms till you lose vision. So that is very important message to be given to especially parents and children who have any sort of eye injury.
So tell me about, like, you know, as I said, that there's just so many more risk factors for glaucoma. So, in your career coming to 2025 now, and you've been doing this for how long?
Last 30 years.
30 years. Have you seen this increase glaucoma, and what's causing?
Definitely, see, glaucoma is definitely increasing as you have an aging population. So it's a disease which increases as you age. So currently worldwide and in India, glaucoma is the number one cause of irreversible blindness. So you have nearly 80 million people affected worldwide with glaucoma. So as the population is increasing, as the aging population is increasing, glaucoma is definitely increasing. There are certain risk factors which increase the risk of glaucoma. The main one is if you have a family history of glaucoma. So if anybody in your family has glaucoma, especially siblings, then the risk of glaucoma to other family members increases. So anybody has glaucoma in the family, all the family members must get an annual eye checkup done. Then if you are wearing very thick glasses for near or for far, what we call high myopia or high hypermetropia, so those are risk factors for developing glaucoma. Then we already talked about eye injury. Then one very important cause that we see in this region of the world is due to medications. So today only I had a kid from Rajasthan coming to me, and one eye completely blind from glaucoma and other eye is very advanced. So what happens that in where they stay there is a lot of dust. So the child had eye allergy. So the parents went and they took some medications over the counter for eye allergies. So these medicines for eye allergy have steroids within them. So although the child got well, this allergy got well, but gradually over time they got used to the habit of putting this eye drop whenever the eye turned red. So gradually the child developed glaucoma, and he could not convey this to his parents, or they also didn't realize till the school master told him that this child is not seeing the board. So that is very important cause, allergic conjunctivitis being treated steroids, especially many places they don't show a qualified ophthalmologist. They just go to the chemist and get a medication for eye allergy. So that is a very serious cause of glaucoma, blindness, especially in children. Then the other risk factors are related to these systemic issues, like if you have diabetes, if you have high blood pressure, and even if you are taking medications and you are getting a low blood pressure at night, what we call nocturnal hypotension. Then some people have problem during sleeping. They have excessive snoring and we what we call as a sleep apnea syndrome. These are some of the systemic conditions which increase the risk for glaucoma. So these patients also need to get an annual checkup done for glaucoma. But the main problem with glaucoma is there are no symptoms until the disease becomes very advanced. So you and I may be having glaucoma at this stage. Unless we go and get ourselves checked up, there is no symptom to warn us that we have glaucoma. So that is why this is becoming a very serious issue. And in our country, we don't really have this mechanism or this habit of going for a routine eye checkup. We only go to doctors when we have some problem. But glaucoma is one disease where you must visit an eye specialist. I told you every 2 years or every once a year, even though you have no eye problem. So
Wow,
that is a very important thing about this disease to prevent blindness from glaucoma.
I think, I realized this, what you're saying about eye exams during the COVID pandemic. Because,
Yes.
we were so focused on our lungs, but when we took those steroids or when our immunity dropped or we developed diabetes or something, you started seeing the after effects. In fact, I remember the black fungus when the outbreak happened, how much it was affecting the eyes. And I think it's because we don't see our eyes, right? We see all the other organs. You're not really seeing the eyes all the time.
Yeah. So the optic nerve, there's very subtle damage which occurs. And like during COVID, you were very right. A lot of people were taking inhaled steroid inhalers, and getting steroid tablets. So this is again very major area which you need to have awareness on.
Yeah.
People don't understand the steroids in any form. If you're taking oral steroid, you're taking inhalers. Some people take nasal steroid for allergic rhinitis. And some people take, face creams for acne which have steroids. So all these can lead to glaucoma. So you have to be aware of that. And also, like you have these anti-aging treatments like Botox. So they can also lead to glaucoma. And people should be aware before any medication you are taking for any disorder. Like you don't have glaucoma, but you have some other disorders. Like some patients have some psychiatric illness like depression, anxiety, or Parkinsonism. Some people have heart disease. Some people have asthma. They take inhalers for asthma. And elderly people have urinary problems. They take some medicines for the prostate. So all these drugs can lead to glaucoma. So when you go for an eye exam, you must tell the doctor what all drugs you are taking because they increase your risk for glaucoma.
I think, you know, somehow we just want to get better very soon, right? So if I have an acne, I'm not thinking about my eyes at all, right? I just want to look good so I can go out with my friends. Or,
Yes.
I have diabetes. I just want my blood sugar to be fine. It's how interconnected the body is in an invisible manner that we as patients just fail to see. And I recently discovered, actually, I used to wash my eyes a lot because you're always told that splash water in your eyes. So I thought if I'm having dry eyes, and if you we all have it now, I think we feel that pressure and tired eyes. So I kept splashing water, and then an ophthalmologist told me that that actually dries it out even more.
Yes.
So there are all these myths. So I came across a few myths on glaucoma, which I wanted to run by you. Um, and again, it might be true, but I wanted you to be the one to decide. So if you eat less food, does it reduce pressure on your eyes?
No, no. There is no scientific evidence regarding this calorie restriction and lowering IOP. But calorie restriction as such is got some health benefits, metabolic health benefits, but we never advise our patients regarding calorie restriction for glaucoma.
Right. And what about if you've never had glasses? Like, my eyes are just fine. And post 60, am I liable to get glaucoma?
So it has got nothing to do with glasses. So although if you have thick glasses, the risk increases, but if you don't have glasses, your vision is normal, you can still have glaucoma. And glaucoma, the vision gets affected the last. So you will have patient with very advanced glaucoma, but vision is 6/6. Is the visual field which gets constricted. So you a checkup is mandated whether you have glasses or no. A checkup is
Right.
mandated.
And what about eye exercises? Because I mean the internet is of course full of it. Look in the distance or draw a figure of eight or do the exercises that Kathakali dancers do. Just keep your muscles fine. If you keep your eye muscles healthy, can you prevent glaucoma?
No, this is again a myth. By eye exercise, you cannot prevent glaucoma because the changes are occurring within the eye. So either you are your eye is short size and that is causing angle closure, or you are developing an open angle. So the changes are very microscopic changes occur within the eye.
Yeah.
So external exercise won't help. And also I want to just convey there is a lot of myth regarding yoga and glaucoma.
Mm.
So yoga on the whole is very beneficial for the human body, and I would recommend everybody should be doing yoga from children to elderly. And yoga has basically three main components. One is physical exercises, second is the breathing exercise, what we call pranayam, and finally you have meditation. So for glaucoma, the latter two are very helpful. Pranayam and meditation are very helpful. Head down postures like Sheets Asana, those are not recommended for glaucoma patients. So if you have glaucoma and your pressure is elevated, you can do yoga, but don't do head down postures because that can lead to very high elevation of intraocular pressure. And if you do regular meditation focused on your breath, that is very helpful for glaucoma patients. In fact, that can lower the intraocular pressure and also increase the blood flow to the optic nerve. So it is very helpful if glaucoma patients do meditation, focus on breathing, that can slow the progression of disease and also lower their intraocular pressure.
You know, when we discuss about treatments or davaiya or surgeries, most people get overwhelmed and they're like, oh, why do we need to talk about this? I don't have any problem right now. I, on the other hand, feel incredibly peaceful because I always like knowing that, there's a safety net. So even if I do get glaucoma, there are ways to delay blindness or to, prevent it. I don't know what it is, but I would really like you to make me feel hopeful about my eyes right now. What is available if I get glaucoma?
That is a good part in our country and, of course, across the world. Now, the glaucoma treatment is really very advanced. You have basically three types of treatments. One is eye drops, then you have glaucoma lasers, and then you have glaucoma surgery. So once you're diagnosed with glaucoma, you are you are asked to put an eye drop. Now the only caveat is this eye drop has to be put regularly for your whole life. Sometimes what happens, you start putting the eye drops and patient develops some redness or some irritation because it's a new drop, and they stop the drop. And many patients, like you said, say that my vision is okay, why do I need? So they stop the drop. So in glaucoma, you are taking the eye drops to preserve whatever vision is left. You are not taking treatment to restore vision. Unlike cataract surgery, where your vision will improve after surgery, in glaucoma, that eye drops are being taken so that you don't get blind. So that has to be taken lifelong. So there are a lot of categories of drops available which you can use lifelong. And in India now there are a lot of advances available with the type of eye droppers, and you have preservative free medications. So that are more gentle to the eye. So these are available. They can control your pressure on the lifelong. We have several patients who have been taking medicines and their disease is well controlled. The second option is to have a laser therapy. So laser is of basically two types. You have a laser for open angle glaucoma, that is known as laser trabeculoplasty, and you have laser for angle closure glaucoma, that is known as laser iridotomy. So these procedures can also be done in the initial part of disease. They help to lower the pressure and control the disease. Now, if with eye drops and lasers your pressure is still high, then you go in for glaucoma surgery. So now you also have a lot of advancements, and you have in glaucoma surgery, microsurgery. It's known as minimally invasive glaucoma surgery. So the adverse effects or the complications are much less, and the pressure can be reduced. But the important thing to remember is, like, patients are used to cataract surgery. They go for surgery, vision is restored, they don't need to come back to the ophthalmologist. It's not like that for glaucoma. Even when we do surgery, it has a lifetime. Like, it may be successful for say 2 years, 5 years, 10 years, but after that your pressure may again rise. So whatever treatment you are taking, every year you have to come back to the ophthalmologist to check the optic nerve, check your visual field, and see whether disease is stable or the disease is progressing. Even though you have surgery or lasers, annual checkup is still mandatory.
But I love the technology of lasers for eyes. I saw a video on just the LASIK laser being done, and to slice open someone's eye and take it out and fix it. I mean, it sounds incredible how much technology has helped us.
The lasers are a very precise treatment. I think good you mentioned about LASIK. So here I just want to have a word of caution. What happens that when you do LASIK, your cornea is shaved off. So if the cornea thins down. So once the cornea is thin, your eye pressure, any instrument which measures eye pressure, will underestimate the pressure. So supposing your normal pressure is 20, and you get a LASIK done. So then your normal pressure may come down to 15 or 12. So you must be aware, if you have a suspicion of glaucoma, or if you have a family history of glaucoma, before going for LASIK, you must get yourself screened for glaucoma. And if their screen is positive, then you should not get a refractive surgery or a LASIK done. And if you have a family history, and then you must get an annual checkup done after refractive surgery, because then the pressure will always come normal. So you won't be able to know. So the ophthalmologist has to see your optic nerve and assess for early signs of glaucoma, or do some tests like the visual field, or what you know known as the OCT test. So that can pick up early disease even though the pressure is not high. So that can happen after refractive surgery.
This is what I always feel about, talking to a doctor versus going online. You know, online it'll tell you what a LASIK surgery is. It'll make you think it's so simple and trustworthy, and you won't have to wear glasses again. It's vision correction, but it won't give you all of this. So you make that choice based on just bare information. uh, it's really overwhelming how badly it can affect you later on.
And there's a type of surgery where an intraocular lens is put. It's called a ICL. Those
Hmm.
who have very high myopia, the laser cannot be done. Then a lens is put inside the eye. So before that, glaucoma must be ruled out, because if you get glaucoma, then it's a very tough time for the patient.
Then, just shifting away from glaucoma, but just a general eye health discussion that I also wanted to end with, screens. And I guess we've been using screens now for 20-25 years. When are our eyes going to adapt to them? When are they going to genetically decide that this is the new normal?
Well, actually, the bigger the screen, the better it is. The more the viewing distance, better it is. So the main culprit is this mobile. So I think first word of caution, the parent should keep mobile phones off kids. So that is the cause for progressive increase in spectacles. What we are seeing is a lot of children are getting spectacles because of near work, and this mobile is the main culprit. So parents should not give for at least till high school the mobile phone to the kids. Then the second issue is that when you are doing a like on the laptop work or on the screen, you must give a break. So ideally, it's recommended like every 20 minutes you give a short break and you look at it. You sit by a window and look at a distant object so that your eye muscles can relax. So you must take intermittent breaks. Don't be continuously on the screen.
Should we be using those artificial teardrops?
See, if you are having symptoms,
Hmm.
so if you're using on the screen, you should try and see that there's no air conditioning directly coming on your eyes, because that causes evaporation of the tear film, and that lead to symptoms what we know call as computer vision syndrome. So if you're having symptoms of irritation, watering, your eyes become red, then you need to put some lubricants. But otherwise, just keeping yourself hydrated and taking some intermittent breaks, that would be sufficient. You don't require eye drops for this.
Yeah, because I think, someone once explained to me that when you're looking at blue light, you don't blink as often,
Yeah.
and that causes its own issues, right?
Yeah. So I think you should try and like hydrate yourself and frequent blinking. So that will do away with most of the symptoms. And plus, I told you, look at a distant object with some after 20 30 minutes of your work
Yeah.
on laptop.
Yeah. And what about the air and all these wonderful makeups we have that make us look so pretty, and all these cleaners and shampoos that serve so many purposes, holy colors and rangoli colors. There's so much of chemicals. How is that affecting us?
Actually, uh, this has a bad effect on the whole health of a human being, not just the eyes. So, regarding your eating, you should try and eat whatever you can, which is organic, or at least wash your fruits and vegetables very cleanly. So, even for glaucoma, eating a large portion of green leafy vegetables is very good. So, organic food after thoroughly cleaning is very good. The second thing is that the whatever you cosmetics you apply on the eye, you must be make sure there is no steroid in them. Because sometimes we have seen patients coming to us, they use some whitening cream on the face and they had steroids. The pressure went to 40, 50. So that should be checked that there is no steroid component in anything you're applying around the face.
Yeah, no, I mean, in fact, even sulfates and parabens, I've been shifting to products which are free of them. Just, I
Right.
mean, I don't know how much it helps, but I feel better.
Yeah,
Yeah.
that will be better for the skin.
Yeah.
And there's one point here. Sometimes we get some athletes with very high pressures.
Mhm.
So what happens that when they're engaging in some weight training or some sports like this, they inject or take some steroids for muscle building. So that can lead to very severe form of glaucoma. So, so I would first recommend not to take
You
steroid.
win one thing and you lose the other thing.
Yeah. So for your muscle building, I
Yeah.
think better not to steroid. If you have use, please come and get your eye pressure checked.
Yes. And what about our diet? I mean, I don't know. I was made to eat a lot of carrots as a child. And, we used to have Bugs Bunny, and everyone used to say, look, he's not wearing glasses because he eats carrots. So you eat yours. Is that all we need for eye health?
So I guess, madam, I think the if you take large portion, like if you take raw food, like 40 to 60% of your diet is raw food. That includes vegetables and fruit, especially carrots and green leafy vegetables. After washing it so that the chemicals are off. So that is very good for the eyes and also for the gut and for all types of diseases of the human body. That is what I recommend to my patients. So organic, if possible, large portions of fruits and vegetables. And I am basically vegetarian, so I recommend a vegetarian diet to all my patients.
Yeah. I mean, this green, dark, leafy green vegetables, I mean, seriously, I think they help with everything.
Yes, they help with everything. And
Yeah.
the other thing is that for general health, like you should go to sleep. You should be interval of at least 3 to 4 hours between your last meal and when you go to sleep. What happens that the body heals itself during sleeping. So if you're having late dinner, then your entire gut and the body is utilizing energy to digest that. So if you have a meal early and there's an interval of 3 4 hours before you sleep, that is very good for in general for the body and can help you prevent several other diseases.
You know, it's just something I'd like to close the discussion with. But when I see LASIX or laser treatment being done by an ophthalmologist, and there's so many videos available, the precision and the sort of stability of hand movement required. Like if I'm doing embroidery and I have to like just embroider a simple knot, my hand shakes. How do you maintain that calm and composure during your surgeries?
So, madam, that is very good question. So, actually, our surgical training is quite rigorous. So, like I am telling for our university, we have first, we have like computer models or robotic models where you operate. So you learn this precision of these hand movements and your foot movement on robotic systems, and then you move on to animal eyes, and then you move on to human eyes after assisting. So there's a long learning curve. So it depends on how thorough are you in surgical training. Once you get thoroughly trained, then of course your hand becomes stable.
Your hand becomes stable. Well, it's good to know your hands are stable. Thank you so much for sharing everything you have, sir.
Thank you, ma'am. Thank you.
For me, the most frightening moment to do with eye health was a couple of years ago. My dog, and he had distemper, and he lunged at my mother and he bit out her eyes. So he had torn two eyelids and made severe dents inside her nose. And I remember I was having coffee with a friend. I just got back to Delhi from a trip, and she called and said, "He's bit my eyes." And I said, "What do you mean?" And she said, "There's blood coming out of my eyes." Um, and I remember rushing her to the doctor. And in dog bites, typically you wash it and you put a lot of soap for 10-15 minutes to try and reduce any infection. So we had to wash her eyes with soap and water, that raw wound for 10 minutes. And then the surgeon came, the ophthalmologist, and he stitched her eyes back. And it was so quick, and she's a diabetic patient, so we couldn't put steroids, we couldn't give a lot of anesthesia, had to be done very quickly. Um, she stayed still. And I remember everyone asking her this again and again, "How were you still?" And she said, "I know that a surgery is a partnership. So the doctor will do his doctoring. I need to have that trust." And she just conquered that huge amount of pain with just her mental strength alone. She just imagined that she was somewhere else and someone was holding her, comforting her, and she got through with it. And her eyes are absolutely fine now. In fact, her vision is getting better. So it is a story I just wanted to share because it
Yeah,
makes
madam,
me feel
I have
beautiful.
one more tip to share before I leave.
Yes.
A lot of patients are using eye drops. So the proper way to use eye drop is to only put one drop in the eye. And after you put the eye drop, you put your index finger and apply pressure between the tip of the nose and the eye for 1 minute. So what happens? This prevents the drug getting absorbed from the nose into the circulation and decreases side effects.
Yeah, yeah. Because I remember being taught this that time because we had to constantly keep the eye free of infections. And it was quite an experience, but made me very hopeful about eye treatments. If you have any health queries that you have or any topics you'd like us to cover, please do write to us. We are available at pods@indiatoday.com and also on 8588 We do plan to continue doing monthly health specials with doctors at AIIMS Delhi. And so if there's, again, something you wish to know more about, please do write to us. And if you've enjoyed this episode and it's made you feel good and added new value to your lives, then please leave us a good rating. We're there on Apple, YouTube, Spotify, and the India Today website.